and welcome to an Insulet-provided Glooko webinar. Today we will be focusing on how you can use Insulet-provided Glooko to make evidence-based adjustments to your patients' diabetes care routines. I'm your host for this webinar, Dr. Michael Greenfield. I'm Chief Medical Officer at Glooko and a practicing endocrinologist. I will review the clinical benefits of insulin-provided Glooko and go over specific patient examples to show you how you can use it to make your own clinical diabetes management decisions. Glooko is provided to OmniPod users, system users, and clinics by the name Insulet-provided Glooko. Insulet-provided Glooko overlays data for the OmniPod system, more than 50 blood glucose meters, Dexcom CGM, and more than 30 biometric and fitness devices, and puts this data together into a unified, actionable platform. The system also provides the capability for OmniPod system users to remotely upload their diabetes devices outside of the clinic by Android mobile devices and Mac or PC computers. With Insulet-provided Glooko, there are three core benefits that enable diabetes management success at your clinic. The first is facilitating patient adherence to the treatment plan, followed by workflow efficiency, and lastly, patient population management. Let's take a look at each of these in more detail. The first core benefit is focused on promoting patient adherence to the treatment plan. This is facilitated because Glooko consists of an easy-to-use mobile app that allows patients to sync their diabetes data remotely, add events for context, review their patterns, and share data with their care team. To upload and sync the OmniPod system data remotely, patients simply connect their OmniPod system PDM via a cable to their Android mobile device or Mac or PC computer. These patients can also upload their BG meters and Dexcom CGM devices. Insulet covers the cost of the remote Glooko app for OmniPod system users. The Glooko mobile app includes graphs and trends to help your patients see their diabetes patterns on the go and through the power of the secure mobile cloud. Their data can be automatically shared with their healthcare provider team for remote assistance as needed or to review at their next clinic appointment. In addition to the Glooko mobile app, the Glooko kiosk allows you to quickly and easily sync your OmniPod and prospective OmniPod system patient data in the clinic. The Glooko kiosk allows you to upload more than 50 diabetes devices into one platform and see a unified view of each patient's data. You can print out a PDF report of the patient's data from the kiosk if you have wireless printers, or view it on your Mac or PC computers using a secure website in your exam room to collaborate with your patients and provide evidence-based care. Since the Glooko kiosk allows you to create an account for your patient, the education and conversation you had in clinic with your patient can be extended to the home where your patient can view the newly uploaded data in their secure account on their phone, Mac, or PC computer. And the Insulet-provided Glooko kiosk is safe and secure. No patient data is ever visible on the tablet screen. It simply securely sends the data to your clinic's secure Glooko site. Lastly, the Glooko Population Tracker is your hub for managing your diabetes patient population online. You can see a list of all your patients whose data has been uploaded in clinic with the Glooko kiosk or at home with the Glooko mobile app. For each patient, you can see quick statistics about their latest diabetes data to help you identify which patients are most at risk and provide timely care. Again, you can select to print a PDF report of their data or click on the patient to view their interactive reports. The graphs and reports in Glooko are user-friendly and accessible to patients and providers alike. All reports visible to the provider are available to the patient as well. Reports include BG graphs and statistics, daily overview, daily trends, daily overlay, device settings, set and site change, temporary basal decrease, and others. In summary, not only does Insulet-provided Glooko allow your clinic to help facilitate patient adherence, potentially improve workflow efficiency, and look at your clinic's population management, it also allows you to upload and view your clinic's patients in multiple ways. Upload in-clinic data through the kiosk or through the web uploader. Then view this data on the computer at my.glooko.com with PDF reports. At home or outside of the clinic, patients can upload through the Glooko mobile app on their Android phone and through the web uploader directly to their computer. Note that this remotely uploaded data is then available in the clinic's Glooko system. Finally, patients can also view their data on their iPhone or Android phone, on their PC or Mac computer, and on PDF reports. Now we're going to take a look at some patient examples and show where Insulet-provided Glooko can help you gain valuable insights for your patient's treatment plan. Please note, this is not real patient data, but simulated data used to paint an example of potential Glooko reports and tools that can be used to help manage your patient. Our first scenario is Joseph, a patient with type 2 diabetes, who is using Basal and multiple oral agents. On this regimen, he saw a rapid decline in his blood glucose control. He did have some blood glucose improvement when his basal insulin was titrated up to 26 units. However, during the past 4 to 6 months, his fasting and postprandial blood glucose values have increased once again, resulting in a significant rise in hemoglobin A1C. Together with his physician, Joseph used data from Glooko to make the decision to move to a continuous subcutaneous insulin infusion pump. Let's take a look at the Glooko reports that facilitated this decision and may be beneficial for this type of patient. To review Joseph's diabetes data, this healthcare professional used the Glooko BG Graphs tab. The BG Graph report shows how often blood glucose readings fall above, below, or within the patient's targeted blood glucose range based on either time of day, day of week, or by date. The target BG range is shown by a light green zone with lines depicting upper and lower limits of the target range. Orange dots represent readings above the target, green dots represent readings within target, and red dots represent readings below the target. For example, if Joseph has mostly orange readings for a specific time of day, then you know that that time period in the day would be a good area to focus on for better diabetes management. For Joseph, he was specifically looking at the standard or modal day graph, which displays his blood glucose graphs report and BG readings by time of day. Right now, you're looking at BG readings uploaded from his meter for the last month. As you can see, Joseph's blood glucose levels are better in the morning before breakfast, which is probably related to his basal insulin therapy. And his blood glucose levels are clearly very high after meals and at bedtime. At his appointment, the evaluation does not reveal any current illness or significant changes in his diet, medication, or activities. Rapid-acting insulin is then added to his regimen at breakfast and lunch, as well as before dinner, and his basal insulin is also increased. After 4 weeks, Joseph returns for another appointment and reviews his blood glucose levels. His blood glucose graphs show that he had one very mild hypoglycemic episode before breakfast, as shown by the red dot, but his control has improved. At a glance, his percent of blood glucose readings in range has improved, while his percent above range has decreased, but is still too high at 72%. Specifically, he displays better blood glucose control in the morning, but continues to have highs in the evening, after dinner, and overnight. He is counseled about lowering his carb intake in the evening and possibly splitting his basal insulin dose. During his appointment, Joseph confides that he is unhappy with having to do multiple injections and oral medications. It's become very burdensome and costly, but realizes that insulin therapy is necessary to keep his diabetes in control. He decides with his physician that it makes sense to try an insulin pump to see if it will fit better into his lifestyle and reduce the burden of taking so many injections and oral medications. After meeting with the CSM for pre-pump training and education, Joseph decides to start on insulin pump therapy. With his new pump therapy and titration in insulin adjustments, Joseph was able to better manage his diabetes and his average BG, which gave him more energy and a better quality of life. As you can see in this patient example, with the Glooko BG Graphs report, you will be able to see your patient's BG levels and readings above, below, and in target range tracked over time. Our second patient example is Allison. Allison is a patient with type 1 diabetes on multiple daily injections. She wants to start a family, but needs to improve her blood glucose management. She's a 29-year-old female and has a 10-year history of type 1 diabetes. However, due to body image issues, she has deferred the use of an insulin pump and CGM. However, being recently married, she and her husband are now looking to start a family. After consulting with her physician and recognizing that her hemoglobin A1C needs to be in better control, she agrees to take steps to improve her multiple daily injection routine. She's currently using MDI, taking rapid-acting insulin before meals and basal insulin. Her current hemoglobin A1C is high, and following her appointment, she carefully follows her diet, improves her carb counting and exercise, and increases her use of her basal insulin, but finds she still needs improvement in her diabetes management. Together, Allison and her physician used data from Glooko to make the decision to move to an insulin pump and CGM. Now let's look at the Glooko reports that assisted with making this care transition. As you can see from Allison's report in the BG time of day graph, her BG range was pretty high throughout the day, and her A1C was much higher than desired, especially given the fact that Allison wants to start a family. As a result, she and her healthcare professional decided to start her on a CGM. The next report that is useful for patients, example like Allison, is a daily trends graph within the Glooko pump and CGM graph tab. The daily trends graph aggregates data for the time range and plots the median BG value and the quartile ranges for each hour, which provides information about the variability of her glucose readings. You can see specific data for each day of the week shown at the top of the panel, while aggregate data for all the days selected are displayed in the larger graph below. Selecting or deselecting days in the upper row will add or remove that day from the aggregate data graph. The daily trends graph shows the patient's blood glucose values compared to their target BG range, as shown by the green lines. This report shows her aggregate median blood glucose values in the 25th to 75th and 10th to 90th percentile for all the days of the week, overlaid on top of each other for the time interval selected. For example, if Allison has a dark blue box representing the 25th to 75th percentile that extends over the upper limit or below her target range, she's at risk for hyperglycemia or hypoglycemia during that time frame. Now let's take a closer look at Allison's specific data. Despite changing her insulin doses and eliminating hypoglycemic events, as seen in the slide's CGM tracing, Allison continues to have extreme variability in her blood glucose readings. In her current regimen, she is currently taking basal insulin at bedtime and rapid-acting insulin before meals based on an insulin-carb ratio of 10 and insulin sensitivity factor of 40. To further manage her diabetes, Allison meets with her healthcare professional to discuss adjustments to her care plan. A pump is again discussed, and Allison opts to start on CSII. Her clinic also supplies her with a Glooko app to allow her to send her data to them remotely when she is not in the clinic to upload. With weekly data uploads, Allison and her endocrinologist are able to adjust her insulin parameters remotely. As you know, with insulin-provided Glooko, when she remotely uploads her data, it becomes available to her healthcare professional via PDF reports. When she uploads in clinic, all of her information is immediately available in the live environment. Allison has shown that she is extremely motivated because she is very eager to start a family. With adjustments, after 10 weeks, Allison's blood glucose control has improved significantly with no hypoglycemic readings and substantially decreased variability. Here are Allison's before and after glucose levels based on the advice and collaboration with her healthcare team. She feels more comfortable correcting now, whereas before she wasn't correcting due to her fear of lows or of using devices and medications in public. Given the ability for Allison and her healthcare professional to view the data easily, Allison's basal and bolus doses can be adjusted as necessary pre and post-conception. Our third scenario involves Stella, who is a 12-year-old individual with type 1 diabetes of 3 years duration. She signs up for an after-school dance program where she has practice up to 4 days a week. But her mother is quite concerned about the potential for hypoglycemia. Stella is currently using an OmniPod system and CGM to manage her diabetes. The OmniPod system fits Stella's active lifestyle since the pod is tubeless. Stella and her mom discuss ways to manage her diabetes during dance, including additional carbohydrate intake, decreasing bolus dosing before previous meal, and decreasing her basal rates before, during, and after dance. Now let's look at Stella's reports that help her healthcare professional determine the best temporary basal rates for exercise or other events where basal rates need to be lowered. To review the use of temporary basals and diabetes data, healthcare professionals use the temporary basal decrease and suspend report within the Glucose Insight tab. Let's discuss an overview of how this report works. The temporary basal decrease and suspend report displays the date, start time, temporary decrease by percentage, and duration of basal rate. In addition, the temporary basal decrease and suspend report also shows blood glucose readings before, during, and after any temporary basal decrease to show the specific effect of the insulin adjustment on blood glucose levels. To optimize Stella's insulin management, after her healthcare professional reviews her specific type of exercise, duration and intensity, it is recommended that she decrease her temporary rate by 60%. Stella is told to initiate this decrease 30 minutes prior to the start of class and maintain this decrease for up to an hour after class ends. If after class Stella has any hypoglycemic events with a blood glucose of less than 70, she is told to decrease her basal rate in 10% decrements until the right match for her class is found and no further hypoglycemia occurs. At the end of the week, the mom uploads Stella's OmniPod system PDM to Glooko, where data is available for her and Stella's clinical team to review. After the first week of Stella's participation in her after-school dance program, and with adjustments recommended by her clinical team, despite decreasing her basal rate by 60%, even 30 minutes prior and 1 hour post-activity, Stella continued to have mild hypoglycemia during and after exercise. Her hypoglycemic events are displayed through the red CGM tracing. Per Stella's physician's instructions, her mother continued to decrease her temporary basal rate. When Stella's basal rate is decreased by 80% and started 1 hour prior to dancing and also continued 1 hour after dancing, for a total of 3 hours versus 2.5 hours, her blood glucose remained stable before, during, and after her exercise. As you can see, with the temporary basal decrease and suspend tab, along with other graphs in the Insight tab, allows you to quickly evaluate the effects of changes in basal rates on blood glucose levels. Due to the ability to share Stella's data remotely with her physician and the adjustments made to her insulin profile and lifestyle routine, Stella saw positive improvements in her outcome, especially during her new after-school activity. This fourth individual is Timothy, a patient with type 1 diabetes on continuous subcutaneous insulin infusion. Timothy travels a lot for his sales job, and as a result, he is constantly staying in hotels and consuming hotel and restaurant meals, which can make it difficult to carb count accurately. He frequently misses appointments, but wants to improve his blood glucose control. He is currently using an OmniPod system and CGM to manage his diabetes. He uses the OmniPod system because he feels it is less intrusive during his business meetings and concealed more easily. Also, he previously decided to start using a Dexcom CGM in order to better follow his blood glucose levels with all of the changes in his schedule due to travel. To enable him to view his diabetes data Overlaid from multiple devices and to share his data with his clinical team, the CDE equips him with Insulet-provided Glooko. Now let's view the reports that facilitated the changes in his treatment. For this patient, it may make sense to start with the Glooko Logbook report. The Logbook report provides a weekly snapshot of important information from average BG and percent basal bolus by day and by time of day, as well as overrides and advanced features like temporary basal or extended bolus. Like other Glooko graphs and reports, data points are color-coded based on above, below, or within target BG ranges. The Logbook contains a legend for clinicians and patients to understand what each item means. This report could be reviewed with Timothy to determine while he is traveling what days to focus on. Next, to review Timothy's diabetes data, his physician uses the daily overview graph within the Glooko pump and CGM graphs tab. Let's review a summary of this report. The report shows glucose data consolidated with bolus, basal, and carb data for a better picture of how these events have an effect on his glycemic control. For glucose data, small dots are CGM values, large dots are BG values, and gray dots are manually entered BG values. If these readings are above target range, then they are orange for high, and below they are red for low. Insulin data is shown for bolus by purple bars and basal by either solid purple lines for basal rate or dashed purple lines for temporary basal rate. A blue box is shown above the bolus for carb information. And lastly, if the user uploads exercise information from an activity tracker, like a Fitbit, it is shown in the bottom of the report. Now let's take a look at Timothy's specific data. This is a close-up view of Timothy's daily overview graph for a single day in his life. From this report, you can see that Timothy's blood glucose values go high overnight, improve in the late morning, and then become extremely high again after lunch, possibly due to severely underestimating his carbohydrate levels or a clogged catheter. Timothy follows his team's instructions and changes his pod and administers a correction bolus. After collaborating with his healthcare professional remotely, due to his persistent hyperglycemia, he reviews his actions with his physician. Also over the phone, they change pump settings in his OmniPod system for a travel profile and discuss options for better carb counting. Due to Timothy's ability to share his data remotely with his physician and adjustments made to his insulin profile and lifestyle routine, Timothy saw positive improvements in his health. So I hope you're able to see a number of different ways that the reports within Glooko in the live web environment can be utilized to manage different patient examples. Our hope is that this presentation has helped set you up to become a better Glooko data management expert and understand the system's functionality. Thank you for your attention.